The most volatile issue on Capitol Hill, health care. The president continues to defend his reform law while his own administration is granting more and more waivers to organizations that say they simply can't abide by it. Chief Washington correspondent Jim Engel reports on the arguments.
The Obama administration claimed today its health care law will bring down costs for everyone once it takes full effect in 2014, as the president made fun of the critics.
You may have heard once or twice that this is a job-crushing, granny-threatening, budget-busting monstrosity. That's about how it's been portrayed by opponents.
A new Health and Human Services report argues that families will save money under the law. The original source of that is a report from the Congressional Budget Office that looked at some provisions and predicted, quote, average premiums would be 7 to 10% lower. But the same analysis also predicted that other provisions of the law would have the opposite effect, saying, quote, average premiums would be 27% to 30% higher, which prompted the Republican chairman of the Ways and Means Committee to issue a statement saying, quote, this report would be laughable if it wasn't so disingenuous. The facts remain clear. The Democrats' health care law increases health care costs. Meanwhile, the Obama administration has now tripled the number of waivers granted those who cannot meet the requirements of the law, from a little over 200 to more than 700.
The Obama administration is essentially admitting by granting these waivers that they better make some exceptions, or else they're going to have the unintended consequence of having more uninsured, not less.
The law now forces all plans to offer at least $750,000 in annual benefits. It's already granted waivers to McDonald's and other low-wage firms. Some fear employers will just drop insurance altogether or hire fewer people.
To hire only temporary workers, to hire contract laborers. And then you get out from under the fines, you get out from under the mandates. But is that really where we want to go?
Hundreds of entities, from banks to church groups to school districts, are saying they can't live up to the law. The group also includes dozens of union chapters, most of which supported its passage, from electrical workers to Teamsters to the Service Employees Union, which organizes low-wage workers.
Employers and unions must give these people a very expensive plan, a plan that could cost as much as half of their annual wage, and they simply cannot afford it.
The waivers last for a year but can be renewed until 2014, when everyone has to get insurance on the job or through state-run exchanges, where many will get federal subsidies.
That's the new entitlement in the health care law that's going to be so expensive.
The administration promises we can have better health care at lower prices. Critics say they're spending $1 trillion over 10 years, so someone will have to pay more. Brett?
Jim, thank you again.